Good morning. Today is Tuesday, July 8th, 2025. Present right now with the Health Department is Pam Hanna, who is the director. And Pam, if you would lead us off on what's happening in your department, please.
Oh, hi. It's good to see you guys. We had a pretty slow June as far as disease investigation went, which was good. And we are working on our June snapshot, so you'll be seeing that come out pretty soon. Nothing real significant to talk about there. And we've been working on strategic planning, and we got a new logo, and some of those sorts of things are working kind of with what we're doing with the pathways recognition, the pathways to accreditation. So we've been busy. I've had a lot of staff taking some vacation time, which has been refreshing and good. I also had a staff member who had an unexpected surgery. So just kind of trying to cover all the bases. One of the things that we are working on, though, that we've recognized as a need is to do desk companions for each position, so that if somebody's out, that we can kind of do the basic of what their job is. So that's one of the other projects we're working on right now. We're also doing some events. We did Clancy Days. We're preparing now to do Frontier Days, and then we'll do the fair in August. But one of the things we're doing with those is we're doing a no fund raffle. It's just interact with us, learn about some of the services that we provide, or do some education. So at Clancy, Jesse manned that event pretty much. He and I split it a little bit, but he had been sick, so he wanted the hours, so I gave them to him. But he really talked to folks about Code Red and getting signed up for emergency notification. And we saw 130 people. I think he talked to 130 people that day. And at least half of them entered our raffle. We were able to give 4 prizes away, so that was good. And we'll do the same thing at Frontier Days, but Molly and Tana are manning that event. So we'll talk about CPR and Tana's home visiting and some of those sorts of maternal child things that she does. So that's what'll happen out there. And then in August, when we do the fair, it'll be probably most of us. We all tend to take turns with that one. We're also doing farmers markets, one a month, and so we'll do the first one this week on the 10th. And Erin and Ton are gonna be there. Erin's gonna talk about car seat check. She's a car seat technician. And Tana's gonna talk about safe sleep and her maternal child visits. So we're just trying to get it out there that public health does a lot of different things, and this is who we are.
It's farmers market. Are you talking about Boulder's farmers market?
Yeah,
Okay.
right here.
Whitehall's, that's fine.
Yeah, we're gonna do it once a month. So I think we decided on the first Thursday, and Connie Grens allows us just to come and participate without a cost because we're not selling anything. So it's kind of a nice way to get out and about. And then we also have a caravan event coming up on August 1st, where we will collaborate with Boulder Medical Clinic. They'll provide sports physicals and we'll provide vaccinations. And Blue Cross Blue Shield, the Caring Foundation, will cover the costs. So it'll be kind of a no cost event for everybody. And then they give the funding for the physicals back to the clinic, but the clinic donates it to Jefferson High's athletic program. So it's all kind of an overall good kind of a collaborative effort. So that's kind of what we've got on our plates right now. And then I'm working closely with the state and with Montana Public Health Institute on that near-term initiative funding. So I sent this contract out to you guys and I copied Steve on it. So this is a subcontract. So we had the task order contract come through that was signed. But this is a subcontract with Montana Montana Public Health Institute, because they're providing technical assistance to us to accomplish that contract. And so we fund them a certain amount of money every quarter, and the layout is on that. So I don't know if you've had a chance to look through that, Dan, but you're the signer on that. And then Matt Kelly, who's the CEO of,
So you're waiting on me.
so I emailed it to you, but you're welcome to keep that copy and look through it.
I will.
I met with Montana Public Health Institute last week, and they asked, if I'd sent the contract through. So I think they're kind of looking for it to be signed. I send in a claim to BHDD at Department of Health and Human Services this week. I have to send them a monthly claim for what services we've done. You remember all the colored. Never seen a contract like that. So anyway, part of what I will send in will be a payment to Montana Public Health Institute. So if you wouldn't mind checking that out, seeing how you feel about it.
You're good with it?
I'm good with it. Yeah, I've read through it. We put it on our letterhead, which is what
Okay.
Montana Public Health Institute asks us to do.
Did Steve get a chance to review it?
What's that?
Steve, did Steve get a look at it?
I copied Steve on the email that I sent, but I haven't heard anything back. He usually will say, I'm good with this, or
Right.
if I have a question about this, but I haven't heard anything.
Okay.
But it was a holiday last week, so I think we're
gone
all
for
okay
10
with
days.
that.
10 days.
And I know Steve said he was gonna be out of town, so anyway, just if we can follow up on that. If I don't hear anything from Steve in the next day or so, I'll probably reach out.
Yeah, let me know,
And
and
I'll
then
copy.
thereafter I'll take care of it.
Yeah, I'll copy you on it. So that's moving forward. Our next steps with that is to hire a behavioral health coordinator. So I'm working on a job description for that. The Montana Public Health Institute provided me some templates for that, and then I'll make an appointment with Kelly and make sure that it's in alignment with what we need for the county, and see if we can't start the hiring process. So that's where we're at with that. With Pathways, some of what I do with that program is I submit examples of what we're doing with public health to show them that we're complying with those standards that they want us to. So this was one thing that they sent back to me. So they asked me why this is an agenda for this meeting, why I'm called the county health nurse, but that doesn't identify me as a supervisor. Actually, they said, why aren't you identified as the public health director? Which most of my counterparts are called a director of public health. I know Noel was called the director of public health, and Karen changed that to public health supervisor. And I'm not sure what her reasoning for that was. So we had kind of a discussion about this in staff meeting this morning about what an appropriate title would be, because actually director of public health doesn't fit very well either, because I am not the supervisor of environmental health. So I'm not really comfortable being called the director of public health, or even the supervisor, which is what I'm called now, supervisor of public health. So I think that supervisor of public health nursing is a better title for me. It's a mouthful. But Matt really is the supervisor over environmental health, and he and I are lateral in how it works in this county, and probably most small counties. Most small counties have environmental health separate, but under the law, public health law, we're all public health. The umbrella puts us all in public health. So my request is can we change my title? I know it says road supervisor here for for Bear. So my request is, can we change my title on this, on the agenda? I know it seems, I know it seems silly, but
I think that's probably a Kelly question, as long as it fits what we have for your job description. I
All
don't
right.
care what we call you, like Helen said, we'll call you whatever you want.
well, and it might be like a job description title change. So I'm, oops, I spelled Kelly, my Kelly's way and not your Kelly's way. Okay,
Yeah,
I
check
will-
with Kelly if,
I will add that to my list because I've got a Kelly list started. But you guys are okay if we put the title to reflect what I do, okay. And then we've also had discussions, Christina as board chair and Jim as health officer and I about the sanitarian's position in environmental health and how to support him. As I said, public health is kind of inclusive of both sides. And Jim and I talked, Madison County will be doing some of the contracting. And their sanitarian is my son-in-law. So I kind of have some firsthand knowledge of what goes on over there. So they actually have 2 sanitarians and they have an administrative assistant that kind of keeps everybody in line. So they work 4/10s and the sanitarians work opposite ends of the week so that there's somebody on Monday and Friday, and the administrative assistant makes sure all the other days are filled. So it seems like a really effective model because you've got somebody with a license, your registered sanitarian, doing sanitarian work and not doing administrative work. So Jim was asking me if I thought Molly had capacity to help Matt. And I think most of the time she does. My concern would be during respiratory season, she's pretty slammed when we're doing shots. But Jim said that during that time of year, environmental health is fairly slow because their work slows down when the weather, gets cooler. So Jim and I talked with Christina because it's a Board of Health concern issue, and she is on board with that if it works. So I did talk to Molly and say, do you feel like you could take on more duties? I mean, half of the sanitarian calls come to our office anyway, because they don't know where to call, and Molly transfers them. So Matt did this, what he might need for administrative help, and he lined this out. So I guess, I don't know if Jim or Christina have talked to you guys about that possibility of sharing Molly with environmental health. Has that conversation come up? It hasn't. Okay.
Nope.
So that's the conversation that's running around public health right now. FYI,
Good,
so you know.
sounds like a good idea to me.
Well, there's some funding advantages to doing that. If Matt is needing extra help and needing administrative help, you're gonna have to hire somebody and pay them benefits. Where
Right,
with Molly, we're already paying her. I think in fairness to Molly, she probably needs some compensation, you know, a raise.
right.
What
Yeah.
that would look like, I don't know. But she's, you know, she's already answering and transferring half these calls. So I said to Jim and Christina, Molly's office is my office. I don't want her necessarily split between 2 places. Matt's calls could be transferred to us. They could be taken care of there. She would need to have some administrative time with him. She and I do bird chair time every week where we sit down for a half an hour and do scheduling and coordination. I would think that she and Matt would need to have a similar type of thing because I'm out of that piece of it.
Right,
But you know, she knows how to, assist the public, and she knows how to do claims, and she picks our mail up and she brings our, I mean, she could do both at the same time.
Sure.
So she would probably need some training on the septic permits and those sorts of things that he does. But really, I mean, you know, I think it's doable. So from my perspective, I think it's something we could do, but I don't know what your feelings are. And I don't know, I know it's gonna have to go through HR, so I don't know if next steps would be to have a meeting with all of us at the table. You guys in HR and Christina and Jim and Matt, or whether you wanna handle it a different way, but that is the discussion that's going on right now.
I think it's mostly HR. We're gonna have to figure out if what she's taken on will fit into the
Well, and that's another,
metrics.
It'll change your job description a little bit depending on what it entails, and I don't know what that is, and whether we hire a sanitarian or whether we contract a sanitarian, however much difference that makes.
I think you're gonna have a hard time getting a sanitarian. There simply
We're
aren't any.
aware.
Yeah.
We're well
And
aware.
Matt is a registered sanitarian, which is fortunate for us. So, you know, if we're making sure he's doing sanitarian work and not administrative work, that helps him with the limited hours he has. Matt and Van, or Zach and Van, it's my son-in-law and his partner are the contractors. And that evidently has gone through Steve and has been approved on both ends. And I haven't swirled in this pot. I even said to Zach, have Van do all this, cause I don't wanna have any involvement in this. But they are contractors and that's what we do. So anyway, I don't know if you want a copy of this. This is what Matt said he thought he would need for help. And I told Christina and Jim that I'm involved in this due to Molly's involvement. But as far as the rest of it, this isn't my position to make decisions or my position
Right.
to drive this, so.
There, Christina. No. No, I think that's great, Pam. This is a good kind of a bridge. And I think it'll make the department more efficient, whether we contract or we hire somebody.
Well, technically, you know, Matt and I are lateral in our positions. And basically, he would be the supervisor of environmental health and he'd supervise Molly under him and the contractors.
Right,
Just like I supervise my staff.
right.
So it makes sense. It's just a matter of working out what that is. I think, you know, another vision that I've had, and you've heard this from me because we talked about it with building expansion, is to be able to put all of public health in one spot. That is my vision, is to bring environmental health in, to bring prevention in, so that public health is all in one location working together. So this is a step in that direction, I think, to have Molly be administrative assistant on both sides.
Yeah, no, I agree. That's great. That would be good.
So I don't know what next steps are, and I don't know if you want me to back out at this point, or if you want me to facilitate any of it, but I think, you know, we probably need to meet with HR and with Matt.
Yeah, no, if you don't mind, Pam, just talking to Kelly, HR, and seeing how this all fits in her mind.
Would you like a meeting set up between HR and you guys and environmental health?
Well, let's see what Kelly says first.
Okay.
And I think once she knows about this and can figure some of it out, then I think we'll probably have to meet and make that decision, but it sounds good to me, like it would
Okay.
solve some of the issues.
Yeah, it feels a little bit.
All right. So I'll add to my Kelly list then to reach out about environmental health.
Yeah, if you need help with that, and just holler, I mean, appreciate you spearheading it. I know it's not your responsibility, but.
Well, it's a little uncomfortable because I'm like,
Right.
oh, this isn't my business.
Well, it's your employee though.
It
but
is,
now
and that's what I said,
That's gonna,
my part in this is that this is Molly and she's hired for me and. But there are times when Molly can, have extra time. And like I said, she's doing claims for me, she can do claims for Matt.
Right.
And, Jesse's gonna be in our office full time because he's not gonna be in the safety office. And Jesse's very good with customer service. If Molly's not at that front desk, he moves in and I think all of us as a staff realize if Molly's not gonna be there, then we're gonna have to, fill in a little bit to help, so.
We should probably get a meeting with Matt together, just us, and figure out what's.
Like a
I
morning,
think
Tuesday
Matt
morning, or-
was asking me how he got a commission meeting and I told him he needed to get a hold of you. So you might be getting an email from him because he
And that's
knows he's.
Tuesday?
Tuesday morning.
That's Tuesday?
Yes.
It's, okay.
And I do think, if we're looking at my title, I think it's probably a good idea to give Matt a title other than sanitarian, to give him environmental health supervisor title, and then that kind of defines that a little bit. That's just my thought, but.
Yeah, we'll have to talk to him and see where his head is. I mean, he's always just kind of worked for Megan. Does he want to step up into that role? I know he can only work a small amount of hours a month, so we'll have to figure out.
Well, from the conversations we've had, it sounds to me like
He's pretty interested in it.
he's interested. I think he'd be a good fit,
I think so. He's a great guy.
and like I said, I don't know that we're gonna find a full-time sanitarian, so how do we make it work so that we get the work done? And
Yeah.
Megan did a good job of, putting some things off from that sanitarian plate, and quite honestly, my department handles some of what environmental health would do in other places. We do all the foodborne illness
Mhm.
investigation. We do all the lead investigation. We help with the animal bites, we take care of the victim. They take care of the animal. So there's some collaboration there. I mean, Matt would have to get involved with a foodborne illness if it was an outbreak. And we were looking at an establishment,
Mhm.
where that might have been a source. But as far as, doing the actual investigation, talking to the ill people, putting it all in the database, we do that on our end already.
Okay.
So, there's some shared work already, and Matt is gonna come to our staff meeting at least once a month so that we can do some of that collaborative conversation.
Great. Well, that sounds good. We'll get with Matt and make sure he's on the same page we are, and
Well, Matt's a good community builder. I think he'll do a good job.
yeah, I think so, as long as he's interested in doing it,
Yeah.
that's great. Cause even if he has limited time, if we've got a contractor, if that's what we're end up with, then he can be guiding them, and at the same time, Molly can be helping him with the other stuff, and should all work out.
Well, and all of that communication needs to go through Matt, or we don't know what the contractor's done, I mean, that was one of my issues before, is that I would get, because I'm the lead local public health official, I would get all of these emails from the state about establishments, and the licensing and the inspections. And so then I'd reach out to Megan and say, have these been done? It says it's not, oh, the contractor's doing it, but I don't know when.
Yeah.
And I'm like, okay.
Yeah, once I learned.
And Jesse's plans, the emergency preparedness plans, a lot of them have a sanitarian, and some of our deliverables have a sanitarian
Yeah.
part where, the sanitarian needs to do certain things for us to fulfill that deliverable. So there really is a lot of cross work that we do together.
Yeah, perfect. That's good. We're fortunate to have Matt, even if it's just a few hours. a
I
week.
think we are. He's smart and he's good, and in fact, my son-in-law actually was the one who helped him study to get his license, so
Nice.
I think that contract will work good. I mean, Madison is a similar county to us and they're close, and I don't know if you guys have met Van, but Van's awesome too. He's very personable, he's smart, he's been in environmental health a long time, and he's an LPN, so he's got that nursing background too, so I think they're a good fit to help.
Yeah, we'll invite them up here to a meeting with us as well, so we can meet them and get to know them a little
Yeah.
bit, who we're gonna
Yeah.
be working with. And
They're good guys.
good,
I'm a little partial to one of them.
I'm sure you are.
Yeah.
That's okay.
I said once, he taught out at Whitehall, he was their Broadfield science teacher at the high school for the last 9 years, and this was his last year. One of the administrators, when they hired him, we were talking about him, and I said, yeah, we scored when we got Zach, and he stepped back and he said, I wonder if my mother-in-law would say that about me.
We can always ponder.
Something to work for.
Always ponder.
Well, thank you. Did
Thank
you have
you, Pam.
anything for me? As I get up and
Uh,
leave?
I think so.
On this behavioral, where was it? Assistant in sports physicals, who's that gonna be with again?
So Boulder Medical will do the sports physicals. We collaborated with them the last 2 years and it worked out great. I think last year we had 45 kids come through there.
Nice.
And like I say, they give the money back to the school, which is another nice thing. So we're gonna try to see if Whitehall is interested in doing it. Maybe, their clinic doing the same thing. Yeah.
And the other thing is, when you said hire a behavioral, was it analysis, or did I put the wrong?
A
one in there?
behavioral health coordinator
Health
is what we're
coordinator.
calling the person. Yeah. They'll work under me. They'll be part-time, like 0.5. And they'll kind of take over some of that crisis diversion work I've been doing, and they'll take over some of the strategies we're trying to implement with our community health improvement plan on the behavioral health side. So things like support groups, we're trying to get some of those organized, things like that. So they'll do the meetings, the legwork that keeps falling off my plate. So
Gotcha, that's. Yeah.
if
that's
I
my
think of
question.
somebody that'd be good for that, let them know we're gonna have a job coming up.
All right.
Thank
Thank you,
you.
Pam.
Thank you, Pam. Have a good
Bye-bye.
day.